Hello friends, welcome to another episode of Bone Doctor. In this episode, I am going to discuss a very common subject of toe injuries. We know in our day-to-day lives, in various cases, our toes get injured. For example, when we walk and we hit onto some hard object, a stone or a brick, or we walk inside our house and we hit the bedside or a table side, and it causes massive pain and injury to our toes. So in this video, I would like to discuss what happens during a toe injury, what are the consequences of a toe injury, and how to treat them, at least most of them, at home. We know that our toes consist of very small bones and joints which are damaged during an injury to the toe. So when a toe is injured by getting itself hit into a stone or a hard object, three things can occur in the toe. First of all, the bones might not be injured. It may be only the muscles or the soft tissue around the toe which may be injured, or it may be the nail bed which may be injured. Secondly, there may be a fracture of the small bones of the toe. And lastly, there may be a dislocation of the joints of the toe. These are the three consequences of a toe injury. So let us discuss one by one what are the symptoms of each and how to treat each of them. Whenever there is a small injury to the toe, that is, it is struck lightly to a hard object, then there may be an immediate pain and swelling of the toe, but the swelling subsides within a day or two, and the pain usually goes away by 24 hours. If this occurs, there is a high chance that the bones of the toe are intact, there has been no dislocation, and it is only an injury to the soft tissue of the toe. In these cases, giving rest to the foot, that is, taking rest, not walking or putting on the pressure on the toes, giving ice to the injured part, and taking some analgesics such as paracetamol or brufen can help in getting relief of such injuries. If the toe has struck with a great amount of force to the hard object, then there is a chance that there is a fracture or a dislocation which has occurred in the toe. In these cases, the toe appears to be deformed, it appears to be swollen, the pain is unbearable, and the pain doesn't subside on taking rest or ice pack or elevating the limb. It may give some amount of relief, but the pain persists. If the pain persists even after a day of the injury, then we must suspect that this is a case of either a fracture of the toe or a dislocation of the toe bones. In such cases, X-ray is a must. You should consult your nearby orthopedic surgeon or general physician, and he will get you to do the X-rays. After X-rays, it is confirmed that whether any fracture or any dislocation of the toe has occurred. If there is a minor fracture or a hairline fracture of the toe, then it is easily treated by strapping of the toes. That is, if the third toe is injured, then it is strapped along with the fourth and the second toe. If the fourth toe is injured, then it is strapped with the third and the fifth toe. Strapping helps in reducing the movement of the toes, and thus it reduces pain and helps in healing of the fractured bones. If X-ray detects a dislocation of the toe and the bones are in wrong alignment, the dislocation needs to be reduced immediately. This is done in a OPD setting by giving local anesthesia or in an operative setting by taking the patient to the OT, and under CM guidance, the toes are reduced, the bones of the toes are reduced and they are strapped so that further dislocation doesn't occur. Dislocation is an emergency. If there is dislocation of the toe, it needs to be reduced as soon as possible, because if the dislocation stays for long enough, means it stays for 1 or 2 weeks, then it is very hard to reduce that toe, and even after the toe is reduced back after an old dislocation, the mobility of the toe is greatly hampered. So if there is an injury which is causing severe pain and deformity in the toe, it needs to be addressed very fast and it needs to be taken care of by a doctor immediately. The good news is most of the toe injuries are minor in nature and they are easily treated at home by taking rest and ice pack. If there is a minor crack, it can be easily strapped along with the other toes. This is how we treat toe injuries. If you have liked the video, please give it a like and do share it. And if you like my channel, do subscribe to my channel. So bye bye for now. Take care.